Hey everyone, welcome back to ShockDoc Medical. I'm Dr. Raad, and today I've got something super intriguing for you. Have you ever had an itch that just wouldn't quit? And not just a random, annoying itch, but one that could be a clue to something much bigger going on in your body? Buckle up, because today we're diving deep into the world of itch, a symptom that's way more complex than just needing to scratch an itch. Have you ever wondered if that persistent itch might be more than just skin deep? What if it could be a sign of a skin condition, an infestation, an underlying systemic disease, or even a neuropathic or psychogenic issue? Sounds wild, right? Well, that's exactly what we're unpacking today on ShockDoc Medical. All right, so here's what's on the docket. We're going to break down how to approach the history and exam of a patient complaining of itch, both generalized and localized. We're talking everything from asking the right questions about the nature of the itch to digging into possible causes like scabies, eczema, psoriasis, and even rare presentations like itch related to intracranial tumors. And yes, we'll even touch on the drugs that might be triggering that relentless urge to scratch. So whether you're a doctor looking for a refresher or just someone curious about the science behind that maddening itch, you're in the right place. Let's kick things off by talking about history, because in medicine, the story is everything. When a patient walks in with itch, technically pruritus, but hey, I like to call it itch to keep it real, you want to nail down the details. Ask yourself, is this itch a manifestation of a primary skin problem like eczema or psoriasis? Or could it be signaling something deeper, like a systemic disease or even a neuropathic issue? Start by getting the character of the itch. Ask questions like, does it burn? Does it tingle? Do they feel any numbness? Or on the flip side, an increased pain sensation, what we call hypoesthesia or hyperalgesia. These clues can point you toward an underlying sensory neuropathy. And don't forget, ask about the impact. How much is this itch interfering with their sleep or daily life? Is anyone else around them experiencing it? And importantly, inquire about their medication history and any substance abuse. Sometimes the culprit is hiding in plain sight, like a drug side effect. Now, when it comes to the physical exam, it's all about differentiating what's primary versus what's secondary to the itch. Look for signs that might be due to persistent scratching or rubbing, excoriations, lichenification, where the skin gets thick and rough, nodules, ulcers, scars. A cool tip, patients often can't reach the middle of their upper back, so if that area is clear, it might indicate that the lesions are just a result of scratching rather than a primary skin condition. And hey, if the patient comes back still itching, do a second look for scabies. Trust me, a second look can be a game changer. Speaking of primary skin conditions, let's run through some of the usual suspects. Scabies. Ask if any close contacts are itchy too, because scabies is contagious. Eczema, a common one, often with a background of atopy. Psoriasis, that red scaly patch can sometimes be accompanied by itch. Urticaria. Now, here's a tricky one. The rash might have already faded by the time you see the patient. A quick test, stroke the skin to check for dermographism, can help you spot physical urticaria. Insect bites, lichen planus, and prurigo nodularis. These are also on the list. And don't forget the prodrome of bullous pemphigoid, where you might see urticated erythema and even blisters before the full-blown rash develops. Okay, now let's flip the coin. Itch isn't always just a skin thing. Sometimes it's secondary to systemic issues or even drugs. Think about sensory neuropathy. It can either cause itch directly or contribute to it in other conditions. The differential here is pretty wide, including pregnancy-related itch, yes, moms-to-be, listen up, iron deficiency anemia, thyroid disorders, both hypo and hyperthyroidism, chronic renal failure, biliary obstruction, including primary biliary cirrhosis, polycythemia, internal malignancies like Hodgkin disease, and neuropathic causes that are centrally driven. Think brain tumors, strokes, spinal tumors, and multiple sclerosis. Plus, conditions like HIV and diabetes might also be in the mix. Now here's a kicker. Certain drugs can cause pruritus too. We're talking about statins, ACE inhibitors, opiates, barbiturates, and even some recreational drugs. And don't overlook the side effects from antidepressants, oral retinoids, and those hydroxyethyl starch products, which, fun fact, they were actually withdrawn in the UK back in 2013 due to the risk of renal damage. These drug-induced itches can stick around for years if you're not on top of it. Shifting gears to localized itch, this is when the itch is confined to a particular area. Often this happens because of constant rubbing. Over time, the skin in that area becomes thickened, what we call lichenification, or it might even get hyperpigmented, develop nodules, or, in severe cases, ulcerate. When you see localized itch, consider contact dermatitis, lichen simplex, Picker's nodule, or localized prurigo nodularis, and even neuropathic causes like notalgia paresthetica, which typically affects the lower border of the scapula, or brachioradial pruritus, which hits the dorsolateral aspects of the arms. Here's something that really blows your mind. Sometimes localized itch can be the very first sign of an intracranial tumor. There are rare cases where, for example, brain tumors extending to the base of the fourth ventricle cause pruritus of the nostrils. Or an intramedullary tumor might result in a one-sided itch on the upper limb. Tumors in the brainstem or spinal cord can even cause itch on the head, neck, or upper extremity. And then there's trigeminal trophic syndrome, a rare but fascinating condition where localized itch occurs due to damage in the trigeminal nerve area. Now, why does all of this matter? For one, if you're a fellow clinician, knowing how to differentiate and explore the root causes of itch can seriously improve your diagnostic accuracy. And for all you listeners out there, whether you're a patient or just a curious mind, understanding these nuances can empower you to ask the right questions when you're in a doctor's office. I remember early in my career, a patient came in with a seemingly benign rash and persistent itch. It wasn't until we dug deeper, asking all the right questions and conducting a thorough exam, that we discovered a systemic issue that needed attention. That's the kind of detective work that makes medicine both challenging and incredibly rewarding. Let's make this interactive. If you've ever experienced an itch that just wouldn't quit, drop your story in the comments. Was it just a simple skin irritation, or did it end up being something more complex? And doctors, if you're listening, how do you approach these cases? Do you have any tips on differentiating between primary dermatoses and systemic causes? I'd love to hear your thoughts. Remember, there's no one-size-fits-all treatment when it comes to itch. While we don't have a magic medication with a precise dose in this discussion, because our focus here is all about the diagnosis, the key takeaway is to always dig deeper. If you're experiencing persistent itch, it's essential to talk to your doctor about a thorough evaluation. The right diagnosis can be the first step towards effective treatment. All right, let's wrap this up. Today, we took a deep dive into the multifaceted nature of itch, exploring everything from detailed history-taking and physical examination to a broad differential that spans skin conditions, systemic diseases, and even drug-induced causes. The bottom line? Whether it's a generalized or localized itch, it's crucial not to just scratch the surface, but to get to the root of the problem. If you found this episode insightful, please hit that subscribe button, give us a thumbs up, and share your thoughts or questions in the comments below. I want to build a community where we can all learn from each other and stay on top of these medical breakthroughs. And hey, stay tuned. Next week, we're going to uncover another groundbreaking discovery that could change the way you look at medicine. This is Dr. Raad signing off from ShockDoc Medical. Stay curious, keep questioning, and remember, sometimes the itch is a signal that there's a lot more going on beneath the surface. Catch you next time.